So today I want us to look at a topic that has been requested a lot, and today we are looking at H. pylori. And as we are discussing H. pylori, we will be doing it with emphasis and reference to children because that's what I do. Okay? So, H. pylori we know very common in adults, but we also look at how it happens in children. The bacteria, because H. pylori is a bacteria, but the bacteria is the same, but you will realize differences between children and adults in terms of the presentation and even in terms of the treatment. So what is H. pylori? H. pylori is a bacteria, okay? And it resides, residence, it puts up its home in the stomach and in the duodenum. Okay? What H. pylori does is that it increases the acidity. Once the acidity is high and it's up and the levels are high, the consequence is that it can corrode the stomach or duodenal lining, leading to ulcers. An ulcer is a break in the lining. Let's say this is the stomach. In fact, let me just draw something better so that we're also able to see where is the stomach and where is the duodenum. So here you have the food pipe, then you have your stomach, then you have your small intestine starts from there. So like that. So you have a valve here and you have a valve here. So this is the stomach. This first part of the intestine is called the duodenum. And this is the food pipe. Otherwise known as esophagus. Okay? So, when H. pylori occurs, it leads to an increase in the acidity levels. Then it corrodes the stomach lining in the duodenal lining, or the duodenal lining leading to ulcers. And so you are going to have either gastric ulcers or duodenal ulcers. An ulcer is a break in the skin. If you can magnify this, let's assume the normal stomach wall is lined like that. Okay? So, when you have corrosion because of the excess acidity, then you have a wound that appears like that. Inside the stomach or inside the esophagus, this one will present with a lot of pain. There will be vomiting, and most importantly, the vomit will be blood stained, or the blood can just leak into the duodenum and then excreted through stool. So you'll have also blood in stool. Okay? Let me just draw this with green like that. Nice. So what happens with this H. pylori? This H. pylori forms a vicious cycle that it is important to discuss about it. H. pylori, I write it here, gets into the stomach through ingestion, through food and drinks contaminated with H. pylori. How? That you take food from a kibanda or a kiosk, there is no running water, there is no point of hand washing, there is no toilet, sanitation is not the best thing that is there. You end up with food that is contaminated. There is a sewer running just right next to the kibanda. You actually unarukanga mtaro ya maji yenye ni chafu na ni maji yenye ni sewage, then unaingia hapo kwa kibanda, then unakula. So whatever is running through that trench, contaminated with fecal matter and contaminated with H. pylori, then it gets its way into the food or the drink that you are having. Once you ingest the bacteria, and the bacteria reaches the stomach lining and reaches the stomach, it is at home. So what does this H. pylori do? This H. pylori causes an increase in the acidity levels. The acid levels actually go high. And when H. pylori causes acid levels to go high. And when the acid levels go high, they favor the proliferation and growth of H. pylori. So it forms a vicious cycle that ultimately leads to corroding of the stomach lining in what is now called an ulcer. So the acid will go high, favor H. pylori to proliferate and to grow. And as H. pylori is growing and proliferating, it is causing the acid levels to increase. How does it cause acid levels to increase? By excreting toxins, and that increases the acid levels. So once you've ingested H. pylori and it has found its way into the stomach and it has started proliferating, what symptoms will you have? The symptoms that you are going to have are symptoms that are going to relate to whatever is happening in the food pipe, whatever is happening in the stomach, and whatever is happening in the first part of the duodenum. Also worth noting is that as soon as you've gone through this valve that is opening to discharge the contents of the stomach into the small intestine, there is another junction here, and this junction goes to the liver, and it goes to this junction here, goes to this bag, and then it goes to the liver and other organs. Okay? And this one is called the gallbladder. The liver produces bile, it is stored in the gallbladder, and then when the time is right, it is discharged into the duodenum to aid in the digestion. And here we are saying that H. pylori is here, it is in the stomach, and it is in the first part of the small intestine. Okay? So this diagram that I've drawn here is going to become very important later on as we do the discussion. Is this thing recording? This thing is recording? Good, great. We are at 8 minutes already. Okay, fine. So the video is going to be a bit long. So we are going to have symptoms, and these symptoms will vary between adults and children. So let us talk about children. What group of children are most affected? From 3 to 5 years all the way to 12 years. Something worth noting is that this is the age group that has started schooling, and we are talking about food and drinks being contaminated. So it has something to do with the food that they are eating in school, because this is the age group in which they start schooling, and they will commonly complain of abdominal pain, stomach pains, mommy tumbo hurts. on off. Mtoto akishikwa na njaa, complaining, anaumwa na tumbo. Kishamaliza tu kupika, umemwekea food kwa table, mami tumbo, stomach hurts. Mami stomach hurts. The moment umewekea food. Actually unaweza dhania ya kwamba anakataa kula ama anakataa food. And this pain will be more when the baby or when the child is hungry, and it will be more especially at night, and we are talking about 2, 3, 4 a.m. at night, and then it will become worse with food. And this abdominal pain represents the stomach lining being irritated by the acid, by the hydrochloric acid. So when the pain is worse, it means that the acid levels are also highest, and since the pain will become worse with food, it means that the HCl levels will be highest when food reaches the stomach and the stomach has distended. That is one phase of gastric acid production. Once food has reached the stomach and the stomach lining has bulged because of the presence of the food, automatically acid is being produced. Acid is produced to digest the food. So once they have started eating, the pain becomes worse and they might end up vomiting. And this vomiting will give them a relief to the pain. And it can become a cycle whereby you drop food on the table, they start complaining of abdominal pain, somehow you push them to eat, the pain gets worse, they vomit and they get a relief. So they might actually want to vomit more and more because it gives them relief. Okay? So ultimately, this one will lead to poor feeding. So poor feeding plus vomiting, over time you have either weight loss or poor weight gain. When you do their BMI, it will be low. Those children will become slender, tall, slender, with inadequate or weight that is not adequate for their age. Now, because of poor feeding and vomiting, if it happens over time, there is also another interesting aspect that happens, is that they start developing deficiencies. Because this age group, these are children that are already on their feet, they are not likely to develop rickets. However, one of the deficiencies that they come to develop along this age group is anemia. Also noting is that the same parameters that are responsible for rickets, that is vitamin D and calcium, if you are to do it, you are likely to get levels that are lower. So, with a low HB and a low calcium and a low vitamin D, what happens? They reduce activity. Okay? So you find a child who has reduced activity. We are discussing the symptoms. Reduced activity. A child who is not interested in the surroundings and not interested in play and just doesn't want to do anything. Okay? When these symptoms persist, the child starts looking sick. Okay? The energy levels go down, decreased energy levels. The skin starts looking pale, and the hair also starts looking pale and unhealthy. Okay? Now, other symptoms that the children around that age group will develop is because of this poor sleep at night, these children will always be sleepy during the day and in school, you will have a decreased performance. Then they might develop a diarrhea, and the diarrhea is not entirely pegged on the H. pylori because the symptoms are up here, but the diarrhea is a reflex towards that abdominal pain. When they feel the pain is intense, they will tend to go to the toilet, pass some stool. When they pass stool, they open up these lower portions and part of the food just goes, digestion is activated and peristalsis, and the food inateremka, and it also relieves the pain caused inateremka together with the acid levels. Some might complain of a headache, dizziness, fevers, sensations of fevers, although the temperature is usually normal. They might get hot flashes, and they might be brought to the hospital, especially with girls, when they are hysterical. Or they'll just have episodes of fainting. And commonly happens with girls, especially in high school. And when they wake up from the sleep and you assess the tummy, most likely they are usually having signs that show acid levels being high. Okay? Other rare things that might happen is that you might have the stool with a foul smell. Good. So let us look at the signs. Signs is what the healthcare provider picks up in the child during an examination. So the signs, you'll have a child who is weak, a child whose weight is low, a child whose BMI is low. You might have a fever on and off. They might come when they are dehydrated because of the episodes of vomiting. They'll come in abdominal pain. And when you check the child, they might be pale because of low HB, because of the instances of low feeding. And on the abdomen, it might be tender. Actually, it will be tender. It will be generalized. But with areas of the epigastric region having the worst of the tenderness. So atakuwa na pain kutoka hapa kwa kitofu kuja juu, sometimes around your area kitofu, but the most pain itakuwa hapa. This is what we call the epigastric region, and this is the region where the stomach is, and slightly to the left. Okay? One of the things that you might also want to find out when these children come to the hospital, that is when you are doing the examination, and what to expect, and I have seen it happening in several occasions, because this stomach has been colonized by H. pylori. H. pylori imejaa hapa kwa tumbo na kwa first part of the stomach, of the small intestine. This H. pylori will follow this tract that delivers bile into the small intestine, and the first organ that they're going to encounter is the gallbladder. So what happens to the gallbladder? It becomes inflamed. When it becomes inflamed, they present with more pain and more vomiting. And the pain is usually so intense that they are not able to sit upright, or they are not able to sleep on their back. When the gallbladder becomes inflamed, now you have a condition called cholecystitis, an inflamed gallbladder. When it becomes inflamed, the walls of the gallbladder will thicken and it will close off. It will close off and it will not be able to discharge the bile into the bile duct. When it is not able to discharge the bile will harden to form stones, and you end up with gallstones from H. pylori. You end up with an inflamed gallbladder from H. pylori. Okay? Gallstones, it's called cholelithiasis. So, for this child who is constantly complaining about abdominal pain, a child whose H. pylori has turned out positive and has not received treatment, you are most likely going to deal with these issues. And these issues are normally diagnosed through an ultrasound scan. Now, we've seen that H. pylori will cause these symptoms, okay? The abdominal pain, vomiting, and all those other symptoms that we have discussed, including inflammation of the gallbladder. But then, what makes these symptoms to become worse? Remember, we are talking about issues with H. pylori and acidity. So, whatever is going to make these symptoms worse is any foods or drinks that are going to increase the acid levels. These are foods that are hard to digest and include cereals, sukuma wiki, commercial drinks like sodas, chemicals in food, okay? Also staying hungry for long, like it happens when they're in school. So they stay hungry for long and then they go for lunch. And what do they have for lunch? Rice and ndengu, or rice and beans. So that will ultimately make the acid levels to become worse and might trigger these symptoms. That is the reason why most of the symptoms that are associated with H. pylori and acidity will rise or will arise when the children are in school, and especially when they are about to close, because the stomach has taken all the beating for the rest of the term, and when they're just about to close, that's when we have those symptoms becoming apparent. The other thing that you also need to consider is medication. What medicines does, like brufen, aspirin, diclofenac. Remember, aspirin is in mara moja, sawa? And caffeine. And caffeine, we are talking about energy drinks or coffee. What these things do is that they reduce the production of the protective lining in the stomach. So the acid levels might not necessarily increase, but the ability of the stomach to protect itself from its own acid becomes compromised. The other thing that will make the acidity and the symptoms to become worse is the concoction that you are making at home with ginger, lemon, honey, and all those things that you are mixing, turmeric, that concoction. If you really need to give children that concoction, then make sure that yourself, you do not have any issues with acidity. Now, there's a video I did earlier on about adenoids and adenoid hypertrophy. And there's one thing that I mentioned, and I mentioned about children who are sensitive, or what we call watoto wenye wako na allergy. These are children whose parents, one or both, also is dealing with issues with allergy. So we'll see them. These children normally come to the hospital more frequently than the rest of the children, and you are likely to get issues with gastritis in these sensitive children than in the rest of the children. And you are also going to get a history of one or both of the parents with issues concerning acidity. Now, one of the symptoms that I seem to leave out is something called bloating. Bloating ni ile tu unasikia tumbo imejaa na imefura. I want you to imagine a scenario where the acid in the stomach is so much, the stomach is empty, there is no food in it, then you've eaten some food and it has dropped into the stomach, and there is so much acid in the stomach. What happens? It bubbles. So you have a reaction between the acid and the food, and it bubbles, and you end up with a full stomach just after a few spoons of food. So that is one of the presentations in children called early satiety. Wanashiba haraka. Unawapatia food, anaanza vizuri, anauma vijiko kadhaa, and after that the child is full because food imeingia, imefika kwa tumbo, imepata acid ni mingi, it has gone into a reaction, imebubble, na tumbo imekuja imejaa hewa. So with this bloating, it will ultimately translate to, a kind of retching, ile kutoa gas kila saa, and it might also translate to flatulence, kushuta kila saa, na ni mshuto inanuka vibaya. So how do we diagnose H. pylori? Okay, now in any medical condition, the diagnosis is usually derived from the symptoms, the story that you bring to the hospital, and then the signs. That is what the doctor or whoever is seeing you or seeing the child comes up with. So when you combine the symptoms and the signs, these are enough to draw a diagnosis, and you'll call it a presumptive diagnosis up until lab works confirms. Now, the test is called H. pylori, and you can do an antigen or an antibody. Antibodies are what the body produces whenever there is an antigen. Whenever the bacteria is present, the body will produce antibodies to fight the bacteria, and this can be detected in blood, in the liquid part of blood. Okay? Antigen is the bacteria itself, and this one is done on the stool. This one is done in blood. Now, I want us to derive a few more symptoms from this thing. Once you have stool that is positive for H. pylori antigen, it means that in that stool there is the bacteria itself. And stool comes from the rectum. It also comes from the large intestine. One property of the rectum and large intestine is that it has absorptive properties. That's the reason why we usually use some meds na tunaweka huko nyuma kwa mtoto. For example, paracetamol. Unaweka hapo nyuma, inapatana na joto ya the body, ina melt, then it absorbs it into the bloodstream and fever goes down. There are also meds for convulsions that can be given that way, and meds to stop vomiting. There are a few other meds that can be given that way. But now, I want us to imagine a scenario where the stool itself has bacteria that has been seen in the lab through a H. pylori antigen test that has come out positive, and then the rectum, where the stool came from, has absorptive properties. So where the bacteria is, the rectum is absorbing the stool that contains the bacteria. And one thing to know is that these bacteria usually release toxins. We say these toxins are what makes the acid becomes worse. But these toxins will also be absorbed through the rectum, and they will go into the bloodstream. Once it goes into the bloodstream, the child ultimately becomes sick. That's when you have symptoms of fever, headache, weakness, the person feeling sick and not looking all right. Okay? So you've done the lab test. Now we come to the treatment. Now, we've mentioned about food stuffs along the video. So the treatment here involves a few things. Unaona watu wanauliza that nimetest H. pylori ikakuwa positive, nimemaliza kit, but bado naona nimerudi ikiwa bado sijapona. I have repeated the test and it has come out positive, kwani haikuisha. Listen, treatment in children, we normally do it for 2 weeks or for 1 month. These are treatment with meds. And usually the meds are a combination of 2 antibiotics plus 1 PPI. The function of PPI is to reduce the acid levels. When the acid levels reduce, it creates an environment that is not conducive for H. pylori to grow. Okay? So it's usually a combination of 2 antibiotics plus 1 proton pump inhibitor or something to reduce the acid levels, the acid production. Okay? So these meds, first of all, are given for 2 weeks and then the test is repeated. If it turns out positive, one continues with the meds for another 2 weeks, up to a maximum of 1 month. Then this is followed by another 4 weeks of this PPI, because you still need to suppress the acid levels enough for H. pylori not to find a conducive environment to come back. So you need another 4 weeks of PPI. So this treatment is going actually to be 2 months plus of treatment. The reason as to why antibiotics are usually combined is because this bacteria tends to develop resistance to antibiotics. So the treatment, that is one aspect of the medical treatment, that is for the drugs. And then the other treatment is lifestyle modification. And it is modification based on what you eat and what you drink. Lifestyle modification. What you eat, what you drink, the periods of hunger, and all those things. One thing that you need to realize with acidity is that it doesn't like a stomach that is empty. So you are more comfortable taking a full meal in the morning and probably a cup of tea or cup of milk, rather than just taking tea and 3 slices of bread in the morning. Bread is made with yeast. Yeast, when it reaches the stomach, it translates to alcohol. Alcohol becomes bad for the stomach. I haven't mentioned alcohol and cigarette smoking because I'm talking about pediatrics, but that is something to note when you're talking about treatment of H. pylori in adults, because those 2 things you need to avoid them, plus energy drinks and caffeine and all those things. But now, if you can take a full meal in the morning, you are safer because the stomach will remain constantly full during the day, and the food that is there will absorb all the acidity that is in the stomach area, and it also gives the stomach a chance to heal. Okay, so what have we tackled? We've tackled the causes, we've tackled the symptoms, we've tackled what we'll see on examination, we've tackled the lab works that are involved, and we've also tackled the treatment. One other thing to note, points to note, is that over prolonged periods and the child has been feeding poorly, the weight will be low, and other components in the body, other nutrients, will also be low. So we're talking about multivitamins, that is vitamin A, B, C, D, E, K, all those. And we're also talking about micronutrients. Here we're talking about calcium, zinc, iron, and all those things. So when you are seeing a child whose weight is not up to where it's supposed to be, and this child has been having episodes of poor vomiting and loss of food through vomiting, it is also important to run these tests through a full hemogram plus other specific tests and look for other deficiencies that can be corrected, because that one is also very important. Now, sometimes, depending on the severity of the symptoms, these children might need an admission because of managing the pain plus vomiting, and rarely, but has happened before, they might also come with issues with inflammation of the gallbladder. So they might require an admission to stabilize them. Once they are stable, then they can go home with the kit. Now, the kit is not available in children. The kits that we have in the market are formulated for adults. But because we said that it is a combination of 2 antibiotics plus 1 meds to reduce the acid production, that's what we just do. We calculate based on the weight and we give it as a kit to use for 2 or for 4 weeks, depending on how the situation will be at 2 weeks. So H. pylori in children is a reality. Don't be surprised when you take a child to the hospital and you find out that they have been diagnosed with H. pylori. It is a reality in children, especially school-going children, and they will present with almost the same symptoms as adults, but the difference will be because children are growing and their growth rate is high, they are likely to run into deficiencies when they have not been feeding well. Okay, so that is all I wanted to talk about H. pylori. It is not that common, I will say. Majority of the children will just present with acid levels being too high, and as you've seen, the symptoms are almost identical. But with H. pylori, you'll have systemic symptoms, including the headaches and the fevers, as we have discussed, because of the absorption of the toxins from H. pylori from the intestines and from the large intestines and from the rectum area. Okay, so stay informed. Okay, please like that video, subscribe to the channel. It is the only encouragement that I need to grow and to keep posting these videos, and I'll be posting one by one until we will tackle all the medical conditions that you need to know concerning children. Good.